All right. Good morning, everyone. It is 9 o'clock here, August 19th, 2024. Thank you guys for being here live for our Monday calls. We are very excited because we are getting closer and closer to AEP and open enrollment. So, very excited to have everyone on this call live. As you know, our mission is to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And thank you for getting the information right out of the gate here. So I'm going to be talking about some fantastic things. We have a guest speaker that's going to give us an update here with Better Health VIP Care a little later on in the call, and we're going to get you up to speed on what's going on in the industry. But first and foremost, we want to make sure that you have one foot in the classroom and the other one in the field at all times. So I'm going to go ahead and share our training calendar for this week, so you guys know what is happening out there in the wild world of insurance. So today we've got some training sessions from our partners at Spark at 12 o'clock today, leveraging your business with Spark using the CRM platform for Medicare. Again, if you're not using that, please get with a team member so we can get you up to speed. Friday was the deadline to make sure that your book of business was uploaded in order to get your postcards out for AEP surveys, in order for your members to know that it is that time of year again. If you missed the deadline, I don't know if we're going to be able to help you with that. But those of you that have already uploaded your book of business, you still have time to clean it up. And then we'll have another deadline coming up as far as making sure that your platform is turned on for the surveys. So if you have any questions about that, please email us at support@askhpm.com. We want to make sure that your book of business is tagged, and this is going to be a busy year, okay? Also, later today at 2 o'clock, onboarding. So if you're new to Spark, this is a great training, 2 o'clock today. Jump in there and get that done. Cigna's doing Medicare health, military health benefits with Medicare Advantage at 4 o'clock today. Tomorrow, you've got Aetna doing their training, their product rollout in Spanish in South Florida. So if you're in that market, check that one out. Devoted's doing an open training at 11. Another leveraging your Spark at 12 o'clock tomorrow. On Wednesday, you've got several things going on. Centerwell is doing our advisor meeting at 9 o'clock on Wednesday. So if you want to join that, if you're in the Orlando market, you can do that. Our very own Ask Al is at 9:30 on Wednesday. And remember, he is your virtual coach. Well, he's a real human being. He's not virtual, but this is a virtual session. And he's here to help you with that. WellCare has their vision for 2025 at 10 o'clock on Wednesday as well. And then our contracting team is available on Wednesday at 11 for any questions that you have regarding contracting. Devoted's doing their rollout session over in the Tampa market Wednesday at 3 o'clock. This is a great rollout session. Always a good time with Devoted. So if you're in that market, check it out. Clermont, Devoted's doing their rollout in the Clermont area at 4 o'clock on Wednesday. And then Cigna also at 4 o'clock is doing LIS training for everyone else. So low-income subsidy training is important in 2025. We're going to talk a little bit about that today. But in 2025, there are massive changes happening to Medicare Part D. We're going to touch on that today on the call. Thursday, we've got our last benefit advisor training for the year. And the reason why is because next month is party month. You've got our AEP kickoff. There's lots of rollouts happening in September. And so we don't want to take away from any of those great things. But our last benefit advisor meeting in person in Orlando will be on Thursday, the 22nd, this week at Andretti's Indoor Karting and Games. I'm super excited about that because I think I have a rematch with Sergio, and I'm going to take him on the track. So if you guys want to see some racing action, come out on Thursday, the 22nd. We're going to have a great time, 10 a.m. And it is sponsored by both Florida Blue and VIP Care, Better Health. So we can't wait to hang out with our friends there and have a fantastic time. Also on Thursday, Spark getting started with the user management. Agency partners, if you have people that's helping you with your Spark platform or your book of business, this is a fantastic training because now you're going to have permissions to give to your assistants to help you with your book of business, which is fantastic. Really, really super excited about that. Or if you have anyone helping you with your book of business, this gives them permissions to do so. HQ, our very own agent portal. We are doing a training at 3 o'clock on Thursday. Check that out. Devoted, a rollout session in Palm Beach County if you're in that market at 4 o'clock on Thursday. And then last but not least, this Friday, we've got Tom Ryan hosting our HPM shop, our Medicare enrollment tool at 9:30 on Friday. There are going to be some big changes and some really great updates for HPM shop. So if you're not familiar, get familiar because you will be left in the dust. All right. So that's the training for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. Want to jump over to HQ. Remember, all the trainings can be found under Learning HPM Training. You click that and you have everything that I just went through live with all the links and everything that you need in order to RSVP for those events. Okay, so that's in your portal system with HQ. Okay. Want to also say thank you to my IT team for updating our recertification page. We're getting more and more recertification links coming out. One thing that was hidden in here that I just discovered is Anthem. We've got the Florida Blue information that's listed under Anthem. So if you're looking for that, it is under Anthem. We might have to do a breakout for that specifically, but I did want to make sure that everyone was familiar with that. Ultimate Health Plans, their certification or recertification launched today. So you were able to go in there and do your recertification if you're selling Ultimate Health Plans for 2025. One other update is once you get done with your recertification, if you scroll down in HQ, you'll be able to start your next one if you're that bold. So there you go. So a couple of updates in HQ. Very, very excited about that. But on the news with Florida Blue, I do want to make mention of the fact that there are going to be some updates as far as production is concerned with certain carriers. Okay. Now, we've learned that Florida Blue is now requiring if you do not sell a Florida Blue Medicare policy within 6 months of your certification, you may not be recertified if you let it go. Okay. So you need to make sure that you are selling Florida Blue so you do not get hit with appointment fees or they do not terminate you. And I will tell you that Florida Blue is taking a very aggressive stance on not allowing agents back in. Okay. So lack of production can mean a termination of your contract, and it also means blacklisting. All right. So if you're not sure if you're going to sell Florida Blue, don't contract with them until you feel you absolutely need it. All right. There's a couple of other carriers I want to make sure that everyone's aware of. Humana and United both require you to sell at least one policy every calendar year. Okay. If you do not do that, you may be terminated and you will be charged for both your past appointment fee and your future appointment fee, which the last time I checked was a couple $100. Okay, just to get back into Humana. United Healthcare, same situation. If you do not sell at least one policy within 12 months, you will be terminated and your appointment will be canceled and you will have to re-up your appointment and you will have to pay out of your own pocket to get that done. Okay, these carriers are spending millions of dollars in appointment fees for you to be able to sell their product inside your states. And if you're in multiple states, that's multiple appointment fees. So keep that in mind. If you are in 3 different states and they cancel you, that means you have to pay not 3 appointment fees, but 6 appointment fees, your past and your future. And these plans are really taking this to heart. So the newest one is Florida Blue. If you are contracted with Florida Blue Medicare, please keep in mind they are looking at your production. If you haven't sold one this year, please make it a point to learn those products, reach out to a Florida Blue manager so you can get up and up. So the next opportunity that you have to offer Florida Blue is going to be a great opportunity for you to, fix that particular issue. Okay. I don't want anyone's appointment fees or appointments canceled, and I definitely don't want you blacklisted. Rumor has it that Florida Blue may become very important in the future, especially for those of you that are writing ACA business. Okay, I will say no more, but I'm just going to let you know that Florida Blue is going to become, rumor has it, very important, especially for those people that are interested in ACA. So again, if you're not sure if you're going to sell Humana, if you're not sure you're going to sell United, if you're not sure you're going to sell Florida Blue, please do not contract with those carriers at this time. Work with something else. We've got several different options out there to make sure that your clients are taken care of. Okay. So I will leave it at that. I don't want to beat a dead horse, but if you have any questions about certifications, please reach out to our contracting team. The last thing I want to cover on this call today is the Part D redesign from CMS. And I'm only going to take a few minutes on this. It's kind of like a teaser because really we can go into a whole training session about Part D specifically. But I'm going to tell you that the agents that learn Part D are going to be the most successful agents moving forward in 2025. Okay. So I'm going to do a brief overview. Now, as you know, in 2025, the Part D coverage gap is gone. It no longer exists as of January 1st. Okay. So this is the new structure. And I hate the way that they design this, but I'm gonna work with it. Okay. This is CMS drawings. They should have went to the Smithsonian Institute to learn how to draw. I don't know, but they did a terrible job at this. But anyway, every year at January 1st, everyone starts at the bottom here. Okay. And on the bottom, you'll see that the deductible for 2025 is $590. Now, your members on Part D, this is a standard design. Your members, according to CMS, would pay the first $590 out of pocket in order to access their drugs. Now, some carriers are buying down the deductible, meaning like, hey, we're going to pay that $590 for you. You just pay your co-pays right out of the gate. So they are, quote unquote, eliminating the deductible. This is carrier design. You probably won't see a Part D design like this out there, especially in Florida. You'll see that the deductibles will probably be zero. Okay. But CMS says, hey, Mr. Carrier, you can go ahead and collect $590 from your members just to get their drugs. So they pay 100% up to $590. Okay. Now, the new threshold is $2,000. This is your out of pocket threshold for your member of $2,000. So when your member hits $2,000, there's no more coverage gap. They go directly into catastrophic coverage. Okay. Now, what all these numbers mean, I'm going to go through very quickly, is CMS has looked at this in two different sections, non-applicable drugs and applicable drugs. Applicable drugs are drugs that CMS has dictated that the manufacturers must pay a discount in order to help out the seniors and the federal government and the carriers. Okay, so that's the number in green. Okay. So for instance, when a member is paying their co-pays, they're past their deductible phase, the member would pay 25%, essentially 25% on the applicable drug side. The plan would pay 65%, and the manufacturer would have to come in with a 10% discount. Okay, that gets you to that 100%. Okay. On the non-applicable drugs, where there's no manufacturer discount, you're going to have the member still pay 25% copay. And then the health plan would have to cough up 75%, up to $2,000. After your out-of-pocket cost is $2,000, the member pays zero for the rest of the year. Let me repeat that. After $2,000, the member pays zero for the rest of the year. That is humongous savings for our seniors. So this is great for the members. I'm not really sure how this is going to float with the carriers and everybody else, but this is what it is. Okay, so what that looks like is the health plan has to pay 60% regardless. And then the reinsurance in that black and white there is CMS paying the 40% on the non-applicable drugs. And then on the applicable drugs, they split it with the manufacturer 20%, 20%. So they're splitting the difference there in catastrophic until the end of the year. Okay. So very high level. We're probably going to have a Part D classes and resources here for you very shortly. So that way you have it. And we'll go into detail in the future. But that's enough out of me. We have some very, very important guests, very important people. VIP care is on the line. And I know we have Jairus and Elena, I think, was going to join us. I know she was having some technical difficulties, but I will leave it to you, lovely ladies, to introduce yourself to the team or reintroduce yourself because I know you have connections already on this call. And I just want to say that Better Health is one of our top MSOs as far as membership is concerned. I think you still guys are number one in our book of business. But just the immense and the strength of the partnership is just fantastic to work with you guys. So, Jairus, Elena, if you want to take it away.
Hey, good morning, Justin. I finally figured out my little technical issue I was having there. So I appreciate you guys bearing with me. Happy Monday. Hope you guys had a great weekend. My name's Elena Atenza. I am one of the field marketing managers with Better Health Group, and I cover the entire West Coast area, as well as Ocala and the Pensacola area. My counterpart, Jairus, is here also, so I'll let her go ahead and introduce herself.
Thank you. Hi, Elena and Justin. Thank you for the introduction. My name is Jadis Torres. I'm the sales marketing manager for Central Florida, East Coast, and Jacksonville.
All right. So I know there has been a little bit of confusion as far as like the Better Health Group umbrella is concerned and a couple of the different lines of business that we have underneath us. So I'll go ahead and get started there. So if you could imagine BHG being the top umbrella, we do have a couple different lines of business underneath, which you guys are familiar with: VIP Care and Salud VIP. Those are both our wholly owned clinics. So we service those clinics top to bottom. Those providers are employed by VIP Care and Salud VIP. So they do not actually own their own practice. We take care of all of that for them. And then we have our affiliate line of business, which is called Votion. So the affiliate providers still own their own clinics. They take care of, things themselves. That we don't service those offices at all. They are affiliated with Better Health Group for credentialing purposes, and they do get some sort of marketing perks from us as well. So that's a little bit of a, high level overview of what the umbrella covers. And about our wholly owned clinics. So VIP Care and Salud VIP only see 10 to 12 patients a day. So the providers get to spend up to 45 minutes to an hour with each of their patients, which is huge because then we're being able to build that rapport with them and they become like family to us. So we take very good care of our clients. Everything is done in-house for our patients, which would include labs, urine testing, echocardiograms, 12-lead EKGs, and a couple other different things. Also, too, VIP Care and Salud VIP both accept 14 different healthcare payers, which is awesome. So we can pretty much see any person, anytime. So whoever you write, we're going to be able to see them in our offices and take very good care of them. So you guys probably want to know how we can partner with you. So we have teams of community liaisons, which I'm sure if you guys are familiar with VIP Care and Salud, you've probably seen one of those people out in the field doing different marketing events, tabletops at different COIs and what have you. So those are really, really good resources for you guys, because I know as agents and brokers, it's huge for you to be able to actually get out in the community and get into some of these different centers that are out there. And for whatever reason, we sometimes have an easier way of getting in there than you guys do, because they may see us as more of a partner versus an actual salesperson. So our liaisons are required to do 16 patient-facing events a month. So if you could multiply that by the 30 liaisons that we have in the state of Florida, that's a lot of different events that you guys could potentially have access to. So huge opportunity there to partner with our reps. Another thing that we do is we also protect your book of business. So we do not allow agents or brokers to set up tabletops or to market themselves inside or outside of any of our clinics. So that's huge because we do want to respect you guys sending us that business. We do take that very seriously and we appreciate the partnerships that we have. So our way of kind of reciprocating is to make sure that nobody's kind of turning over business inside of any of our centers. Also, we have marketing dollars available to us. So if you guys are out doing an event and you need some support, feel free to reach out to Jairus or myself, or if you have an existing relationship with a CL, we can come, we can bring your goodies for bingo. We can help you, pay for that vendor fee at this big health expo that you're doing, et cetera. So those are also really good things that we're able to do with you guys as far as partnerships are concerned. And I know also too, this year, there's a lot of changes with CMS happening. And of course, we're feeling that on our end as well. So just some little tidbits that have been given to us so far. Of course, none of this is set in stone, not definitive as of yet. But the buzz that we are hearing is we are still not accepting any new devoted patients as of right now. So we are still seeing our current devoted clients within our offices, but just not any new devoted at this time. We are in the process of negotiations, so that may change. But again, no updates as of yet. Second payer that we have some updates on is going to be Aetna. They're kind of falling into the same boat as devoted as of right now. So ideally, we are kind of steering clear of those close partnerships with Aetna, but by no means are we turning away new Aetna patients as of yet, nor are we turning away those marketing co-op opportunities. Next thing I have here on my list for you guys is how to find the provider directory. So I will be sending a follow-up email to you guys so you actually have the link, but a quick, easy way you can always do is go to our Get VIP Care website. It's super, super helpful. It is broken down by county. You can even search the zip code that you're currently in. So if you have a client and you're in a pinch, you can go ahead and pop onto that website, and that's how you can search your directory. And then just a little side note as well, if you do have a close relationship with your CL, they are a walking provider directory themselves. So go ahead and reach out to them and they should be able to point you in the right direction. And I know everybody's excited about all of the VIP Care AEP festivities. So we are actually doing an AEP rollout of our own. So it is going to be just more of a celebration and a thank you for your partnership and just to get you guys excited going into AEP. So we are going to have a couple different events happening throughout the state. The first one's going to be happening in Orlando on September 19th. The second is in Ocala on September 26th, and the third in Tampa on October 3rd, and a couple different smaller markets sprinkled in between there. So you guys, again, will be receiving that follow-up email with those invites attached. So at this time, if you guys have any questions at all, please feel free to ask.
Awesome. No, thank you very much. So everyone on this call is gearing up for AEP, and I know both of you have been through this battle before on the provider side. What would you recommend these guys be doing now? It's August 19th. They're doing their recertifications, but we've been talking to them about lead generation because you can't get to October and not have anybody to talk to, right? So we know that there's, the first thing is they're nervous about their books of business. The stats are saying as many as 90% of seniors are going to be shopping for business. From a provider's perspective, what do you think these guys should be doing right now, in conjunction with working with Better Health and VIP Care?
I do really think the provider relationships are super, super important. So we have an open door policy at VIP Care and Salute VIP. If you guys are familiar with any of our clinics, pop in there and start to get familiar with the office manager and with the provider themselves, and even with the MA, because they're just as important. So the more face time that you get with that group in there, the better success rate that you're going to have leading into AEP. And then also that leads to referrals on your end. So a lot of the referrals that are given out from us are relationship based. And that doesn't necessarily come from the liaison. I'll speak about that in a second, but from the provider themselves. So if they say, Justin has been in here every week for the last 2 months just to say
Mm-hmm.
hi and see how I'm doing. He's going to see, Mr. Smith has an issue with his, insurance plan. He's going to want Justin to make sure that his patient's taken well care of because he feels comfortable with that agent. So I think that is a really, really important relationship to kind of cultivate. Also, too, with your liaisons, like if you can reach out to them, I know they try to partner with you guys as well. So the more that you interact with your liaison, the better success you're going to have. And then also, we plan months out in advance for AEP. So a lot of the team already has their AEP schedule already taken care of. So if you're in need of patient-facing events, prospect rather, start to reach out to your liaisons, see how you can help them. And majority of the time, they're just going to invite you to come because everything is all taken care of. So at that time, when you start to go to these different events, you will generate those leads, out in the field. And then on the flip side, from the CL, let's just say you're swamped, can't make it to the event for whatever reason. Again, the liaison is going to think of you first because you've been reaching out to them. And if they run into a client out in the field that, again, needs help servicing their insurance, they're going to reach out to Rosie and say, hey, Rosie, I met so-and-so at this event and they need some insurance help. Can you please, reach out? So I think that's important.
More about the type of events that you guys are doing.
And I couldn't say we have a great relationship with Cecilia in our area. She's amazing and she's bilingual, so we love her.
Cecilia is awesome. She's one of the ones that already has her schedule all taken care of. I think you might be on mute, Justin.
Can you hear me? There we go. All right. I don't know what happened here. So, can you talk a little bit about the type of events that you guys are doing out there in the field?
So it honestly varies rep to rep. Each person has a different preference as to what kinds of events they actually like to do. And then as far as what works in their market. So it's not really one size fits all. But I will say I can speak highly on the T65 events for the West Coast area. I say majority, if not all of my team does what we call T65s. So we partner with a third-party vendor to send out mail into, a 5 to 7 mile radius of one of our target locations. And then we host that event at a restaurant or some sort of senior center that has event space available to us. And we will partner with an agent or a broker on these events to educate the turning 65 population on all things they need to know, aging into the system. So it's a partnership on this. So provider and insurance is important here. So the agent would do the turning 65 educational presentation for the event. And VIP Care, our CL, will do everything they need to know about, the provider's office, the local doctors in the area, services that we give them, and what have you. Also, too, we talk about the different insurance plans that we accept. So those are some really big ones. We also have been doing some expos. So just some general health fairs. And then, the little fun ones we still kind of keep going, bingo and Zumba or whatever may be going on in the community. And for you guys as well, a really good one is hurricane preparedness. So we are already in hurricane season, but depending upon the area that you live in, your local fire department most of the time will come out and do it free of charge. They have a community outreach program or just an individual that goes out and does these presentations. So those are really, really helpful for the seniors in the area, and they seem to attract large crowds, as well as cyber safety on the flip side. So as we go into the new year, cyber safety is a really great one. So make sure to be reaching out to your local sheriff's office or your police department they also too have something similar to the fire department. But Jairus may have some different things going on in her market. That's kind of what I have on my side.
Yeah, I think each market is different, and each liaison also as well. So if you want to do any event with any of marketing liaison, community liaison, sorry, just reach out to them. We're gonna send you, I believe you, the spreadsheet with all the community liaison we have in Orlando area and also Tampa.
Awesome. And yeah, one of the last things somebody had chatted here, who's the right person to talk to about events? The easiest way is we're going to connect you with the VIP care team and Better Health team. So just send us an email at support@askhpm.com and we'll coordinate the reps in your area. I know Rebecca's asking, do you have someone in Lakeland? Do you have somebody in Lakeland working that market? I'm assuming you guys do because you have centers there, right?
That's going to be Cecilia.
Oh,
so
yep.
She's awesome. I'll make sure she'll be part of the contact list for you guys.
Absolutely. So,
and it will have their location attached as well, so you know what area they're in.
Perfect. Yeah, if you can send that over to Nick if he doesn't already have it. One thing that we're doing internally is if you do have a great relationship with a VIP care center or a Better Health doctor, we're tracking that so that way we don't overlap or send two people to the same clinic. We just want to know if you're working those centers, if we have opportunities in those centers that we go back to you and not look for another agent. So if you are building those relationships, please let us know so that way we can track it. Also, when we run reports, I'm sure Jairus and Elena want to know who's doing sales for them, right? And so behind the scenes, we're promoting you guys and saying, hey, did you know that Ryan put in 5 sales for you guys and Mary put in 10 sales, and so we're doing that behind the scenes with their leadership, and knowing that you guys are working those centers is really important. So anything else to recap or to cap off before we close out?
I do want to kind of piggyback off of what you just said, Justin. That was going to be my finishing thought for you guys, was how incredibly important it is to get that report back from you. So if you guys are sending us business, please, please, please give that to the rep that is assigned to that office. And if you don't know who it is, feel comfortable reaching out to Jairus or myself, and we can always help direct you in the right way. It is so important to us. And obviously the liaison makes a commission based upon how many new patients that they are bringing into the centers. Not only that, we take into account who is sending us that business, and we create a table and recognize those agents who are sending us large volumes. So it's not going unnoticed that you guys are sending us new patients.
Awesome. No, we really appreciate
it. We have a report getting in the works right now. We got it last week to get the doctor's name, so I should be able to get that back to you here soon and show you who's been helping you guys grow your business.
Thank you.
Thank you, Nick.
Awesome. Fantastic information. Thank you both for being on the call. We really appreciate your partnership. Most importantly, thank you for all the opportunities that you provide Health Plan Markets and our entire team. We are very grateful that you are such great partners with us. We will be at those kickoffs. So save a seat for me.
Yes, please.
We'll be
They
there.
should be fun.
Awesome. No, I know they will. They always are. So thank you very much for being on the call. For everyone else, you got it. For everyone else, I hope everyone has a fantastic week here. Remember, we're going to do these calls throughout AEP, and these are hosted on YouTube in case you do miss a call. You can go out there. So just make sure that you subscribe to YouTube, and we can get you these calls in case you miss one. So with that, have a fantastic week, fantastic Monday, and we'll see you next week. Thanks, guys.